Hi, everyone. Thanks so much for having me today. I'm really honored to sit on this panel and moderate, and I'm glad we're actually getting started a little bit early because I know we have a number of things we wanted to talk about today. So as Arun said, I'm a clinical psychologist in New Jersey and particularly interested in autism in adulthood. And I'm actually going to turn it over to our panelists to introduce themselves so they can tell us a little bit. And I think we are going to start with Jairo.
Hi, everyone. I'm Jairo Arana. It's a very rare name, so I decided to put like the pronunciations to make it easier for everyone. It's got like, wait, well, how do you pronounce it? So it's Jairo. And I'm a clinical program coordinator here at the University of Miami Mellman Center for Child Development. And I assist, I do administrative duties. I'm in the office today, and I don't know how to blur the background, but it's a nice office setting. And I'm very involved with the autism community. We'll get into that later, but my main function here is, aside from administrative duties, is we have a pipeline program on leadership for self-advocates. So we have our land, we're a land and a USED. And then as we talk, I'll learn more of what the work we do here to help people with disabilities, people with autism, and people with disabilities in general. So it's a pleasure to be here. Thank you for inviting me. I'm glad to be here. Thank you. Nice to meet you all.
Anne, I think we have next.
Okay, clicked on it. So, hello, I'm Anne Grego-Nagel. I am the Human Factors Engineer here at Autism Speaks. And before coming to Autism Speaks, my research focused on older adults. So it's sort of a sweet spot for me here. I was diagnosed with autism in my late 40s after 6 months bout of mutism. So, and it's a privilege to be on this, and I especially enjoy working with our science team. So thank you.
And next, I think we have, and you'll forgive me if I mispronounce, is it Elisheva?
I'm Elisheva Levin. I'm from New Mexico. I work at the Center for Development and Disability, where I am a postdoctoral fellow. And I was also diagnosed in my 40s because of my son, who is also on the spectrum. And aside from my work, I am a rancher and have been an outdoors person until recently. So I'm really honored to be here.
Thanks. And next up, we have JoAnne.
Hi, I'm JoAnne Lovegrove. I'm a retiree living in Prince Edward Island, Canada. Late diagnosis as an adult as well recently. And I am also the parent of a 26-year-old with autism. I'm here today just because I was invited and I thought it would be a good idea. The last couple of years, I've been involved with Autism Speaks Canada, and I'm very interested in helping other people to realize we're pretty normal.
Thanks, JoAnne. And then last but not least, we have Karl.
Hi, I'm Karl Wittig. I live in New York City. I just qualified for Medicare, which officially makes me a full-fledged senior citizen. And I'm a retired electronics engineer who worked in research and development for nearly 30 years. And I was diagnosed on the autism spectrum, Asperger syndrome at the time, when I was 44 years old. So that's just over 21 years ago. And this was very significant for me because, as with most, just about anybody past a certain age, any adult past a certain age on the autism spectrum, we were all diagnosed as older adults, which means that we lived our entire lives on the autism spectrum, and neither I nor anybody else knew about it. So consequently, when I finally was able to nail down my diagnosis in August of 2000, I felt as though I literally had my entire life explained to me in one shot. And as a result, I've been involved in many aspects of the autism community. I've been attending and have also facilitated and currently am involved in organizing support groups for adults on the autism spectrum, and also been involved in attending numerous workshops and conferences like this one, and speaking on panels, and just generally being very involved with the autism community. And to wrap up, I'd just like to say, as a retired engineer, my big hobby these days, which is something I've done literally since early infancy, I like to fix up and restore all sorts of old and vintage and antique electronic equipment. And as you can see from my background, I use it, once I get it fixed up and working, I use it to decorate my apartment.
Wonderful. Thank you for sharing. And thanks to all of you for being here. I'm really excited to kind of get us started. So for the audience to know, we have, I think, 6 questions, which everyone has seen in advance. And for the first question, we have an order. We're going to go in reverse order of the introductions. And then after that, we'll just let people unmute as they want to speak. I will also paste the questions in the chat so you can see them there. And if anyone feels that more comfortable contributing via chat, then that's absolutely fine, of course. Just make sure that you turn on the send chat to everyone so that everyone can see your response. Okay. So to get us started, the first question today is, as you have aged, are there attributes of autism that have posed either the greatest challenge or the greatest benefit to you? And Karl, we'll have you start us off.
Okay. Well, I'll start this on a more positive note. And I realize that I have been unusually fortunate, and this certainly won't reflect anybody's experience, but I feel that in a lot of ways, things have gotten better for me as I aged, because number one, a lot of living with autism, whether you've been diagnosed or not, is that you develop a lot of coping mechanisms to deal with the basic deficits that living with autism presents for you, such as social skills and socialization and basic daily living skills being the most significant of these, but others as well. But as we get older, at least I know other people on the spectrum have developed all sorts of coping mechanisms over the course of our lifetime, depending on our life experiences. And certainly as you get older, those mechanisms are better developed. So I've become in many ways better able to cope with a lot of the usual autistic challenges than I was earlier in my life. But it's something that happens very gradually over the course of your lifetime, in contrast with the typical person who just picks certain things up very quickly. At worst, a slow start. For myself, and I'm sure for many, if not most other autistics, it's something that happens slowly and gradually, but as you get older, it does get better. And to conclude, another thing that I found worked to my favor is that as you get older, when people see an older person, they tend to be more tolerant of personal peculiarities and see them as eccentricity, which is somewhat better tolerated than it is with a younger person, or certainly an adolescent or a middle school person, for which, these same differences and peculiarities are as close to a death sentence as you can get, and even as a younger adult can pose a lot of significant challenges. Okay.
Thanks, Karl. JoAnne, do you want to share next?
I could unmute. So for me, the greatest challenges of living with autism has been my bluntness. It's, when you say something to somebody like, whoa, you don't look good today. And then you realize, oh, I probably shouldn't have said that. I just did it yesterday. Even now, I'm still doing it. But it has also proven to be one of my greatest strengths because my former partner and I, we had 5 different businesses going at the same time. So my ability to be blunt made sure that staff were doing what they needed to do. I didn't have to explain everything out very explicitly. It was just a very short and simple kind of thing. So for me, it literally boiled down to the bluntness. And until I was diagnosed, everyone just thought I was rude. Whereas for me, it was a method of being very effective in the smallest amount of time. That has proven to be very good for business, but not so good for society, for social skills. So trying to find that balance, I still haven't found it yet. That's pretty much the only thing that I could think of, because it's just unfortunate that my greatest challenge is also one of my greatest assets.
I think we hear that from a number of adults. Thanks for sharing, JoAnne. Elisheva, do you want to share next?
Sure. So I think the first thing I wanted to talk about is the challenges that I see as I'm aging with autism. I think of it as a triple whammy because there's a lack of respect for women as they age, to the point where, there's the little old lady syndrome that we see in the medical field. And I find I have to assert myself more. Now, the benefit of that is that, like JoAnne, I'm pretty blunt, or I can be. And so I just say what I think. But at the same time, if you push too hard with that, especially in the medical fields, with medical people, they tend to see you as a problem rather than as a partner in providing, getting medical care and the appropriate care for me, because I have, on top of autism, some other things like essential tremor. It's just this whole genetic syndrome that comes from my background. So that would be the challenge. But the benefit is that I finally found my voice. I found it late because I didn't know why I had such a difficult time as I was going through school, and then particularly high school, which I hated. The At 17 song, that was my song. But as I got older, the benefit is in my middle age period, I found out I had autism. I found out through my son, who, by the way, is 29. I can't believe it. And he lives in Texas and has a successful business. So there are benefits there. And I do a lot of work with the LEND program at our UCED, the University Center for, oh goodness. Anyway, I'll let that go. I'm kind of noun impaired, as you'll see. And I think that I have a more practical voice now that I have an adult child, and now that I understand myself, and I'm able to just step in and say, hey, this is where we're at. Here's where we might need to go with this, with the students that I work with, and with the other autistic adults I work with, as well as with, non-autist neurotypicals. And I'm able to do that. But there is a hard side to it, like JoAnne had mentioned, that women, particularly when we become assertive, it's not respected in the same way as assertiveness in men. So I want to leave that on the table because there's some cultural stuff we have to work with still. And I think I'm done.
Those are great points. Thank you. Anne?
Okay. Thank you. At this point, I've got to say the biggest challenges I face every day revolve around sensory issues, and especially how it's affecting with climate change, because I'm less able to predict what the temperatures might be, what the barometric pressure might be going through, that kind of stuff. So that has been one of my biggest challenges as I'm getting older, is because my sensory issues have totally changed. My stomach issues no longer exist like they did when I was a kid. A lot of the stuff that I had problems with as a child or even as a 20-something are now pretty much gone. But I have a different set of sensory issues. So if you're a parent, I really strongly encourage you to reassess as your kids grow up what might actually be affecting them. Because I did get a lot of, when I hit, in my 40s of, well, this still bothers you, this is how you are. And you're like, no, you're framing me from where I was when I was like 12 or 13. So it's really important to go through and reframe where we're at, because we're constantly changing. Our bodies are constantly reacting to the environment differently. Unlike some of the other folks, the greatest benefit I've had in aging has been, instead of other people are like, we sort of disappear as older women, I have loved that cloak of invisibility that comes with middle-aged life here in America. And mainly because people don't notice me as much. So I can really go out and have a lot more fun. I don't have the social requirements on me that required me to mask all the time. And were really, and they just drained my energy. One of the best things I fortunately have had is I've had wonderful people who've introduced me to wonderful people so now I have a couple of friends groups that are autistics, and the research shows that autistics tend to have no trouble communicating with each other, that our problems more lie communicating with non-autistics, and non-autistics tend to have a problem communicating with us. So it's not all on us anymore. Okay. But because of that, I have this great friend group that can help me when I have to navigate certain systems, that help me to self-advocate and help give me the language to explain what's going on. Because for a long time, I didn't have the language to explain that this is bothering me and this is why it is bothering me. But having friends to say, I've got this, and they will help me and say, oh yeah, this is how you can explain it. That was a game changer for me. So it's also, as I've gotten older, I've learned how to manage social demands, and I don't rank them. I've lost a lot of that anxiety because I now know which social demands are important and which ones aren't, and who I can ignore and who I can't. And that has been really helpful, because I think that's something that intuitively a lot of people who aren't autistic know which demands to rank, but I didn't have a clue sometimes. So that's pretty much what I have to say. So thank you.
Thanks, Anne. And then Jairo, do you want to answer this question as well?
Yes, Dr. Ball, thank you. Well, the first thing, I'm going to start with one of the challenges. And I mentioned it in the chat. As soon as one of our panelists mentioned that's like, oh yeah, I was diagnosed late in life. I'm like, it was Karl. He was like, oh, I was diagnosed late. I'm like, oh my gosh, so was I. And then, pretty much everyone here was diagnosed late in life. And it's like, I was 40 at the time, and Asperger's was, added into the DSM-5 as autism. And I'm like, as soon as I heard autism, Asperger's autism, I'm like, what's that? And why am I finding out about this now? Why wasn't I diagnosed earlier? And I think that was the big challenge, is being diagnosed late in life. And I can relate to pretty much to what everyone on the panel has said. It's like, it resonates with me. It's like, I've had those experiences where, I didn't feel like I fit in. I also grew up in Latin America, so I'd vacation here in the U.S. in Miami, but sometimes the cultural attitudes, the way people treated people with on the spectrum, and many of them possibly even undiagnosed like me. I had to learn to mask, cope. I was in a school where I did get bullied and teased, and I didn't know why. It wasn't until I switched to a new school. I went to a high school where I pretty much reinvented myself over the summer and was able to mask and hide my autism. But I think it came at a price too, because I like being myself. I don't like to pretend to be, non-autistic. I mean, why do I have to do that? But then if I don't, then I get teased and bullied, or I would. One of the strengths that I've had, that I have now, is I've met other people on the autism spectrum. I've learned more about autism by interacting with other people on the autism spectrum. But that's because I'm fortunate enough to be in an environment where that is what we focus on. And here at Mailman Center, we have our LEN program, which is Leadership Education in Neurodevelopmental Disabilities. I hate acronyms too, but it's like I try to memorize them. It's like I have to write them down. And we have a UCED, University Centers for Excellence on Developmental Disabilities. And it's like, and then I've gone to the AUCD conference. I'm like, oh my gosh, other people on the spectrum and other people with disabilities. I'm like, okay, now I'm starting to get it. And then I start to learn about intersectionality. It's like, wait a minute, look, I'm doing okay. I'm employed. I still live with my parents, and sometimes they drive me nuts. I don't think they want to let go of me either, because they are aging. And now that's something else that's, I'm concerned with. But, now I make it it's like my work is about helping other people on the spectrum, and people with disabilities in general, people who feel marginalized or who are being marginalized. And so then I'm like, oh my gosh, yeah, that makes so much sense. So I kind of like put myself out there to help as much as I can. I'm involved with we'll get into that later, but one of the things I've learned is learning to use plain language, because like I like to read a lot, but I'm very visual. But then sometimes I'd be like using words that other people didn't understand, and then it made me come across a certain way. And I was like, wait a minute. So now I've learned to navigate that, because it's like, wait a minute, not everyone's as verbose as me. Not everyone's. I also have ADD, so sometimes I'll go off on a tangent. Sometimes my associative thinking, where it's like, if I so much as hear a song I like, or a pop culture reference, I go to that, and it's like, and the conversation just takes another direction, and so I have to like refocus. It's why I like printed everything, and like, so I can stay focused and answer the question. I don't know if I've answered everything right, but and I did have sensory issues. I remember wearing, every time I tried on those jeans as a kid, I hated it. It's like it would itch, and, it's like it's so annoying. But I've learned, and I've learned from other people on the autism spectrum. Right now we are much better as a society here with acknowledging, accepting, and being aware, but also accepting. That's very important. We got to be accepted. We've got to, we'll work on our end, but we also need society to accept us for who we are. And we'll meet halfway down the middle. And maybe if I'm too blunt, or maybe I've learned to not to be so blunt. And then I was like, wait, what did I say that was so wrong? And it's like, so all these little soft skills that you learn along the way, and you learn from others. And then you get the social coaching. I was very fortunate that here we have lots of resources. There's like for adults on the spectrum, like social, going out before the pandemic, when we're able to go out and do outings, and we'd be assigned social coaches. And I was like, wait, it's like, oh, I have to, learning how to interact with other people. So, but we have a lot of resources here. We're very fortunate in that sense. I'm concerned about other communities that may not have the same resources, but we can get into that later. So I hope that answered all your questions. I don't know if I went off on the tangent or anything. Please let me know. Thanks.
That was wonderful. And really, I think for all of you, hopefully know that there's no right or wrong answers. You are the experts in yourselves and your experiences. And that's why we're so glad to have you all here today. You'll forgive me. Apparently, they've decided to cut the grass outside, despite not having cut it for about 6 weeks. So, but they'll be out there for a while today. So we're going to move on to the next question. And now I'm going to stop sort of pointing fingers at people or my mouse and let you sort of naturally bring up the conversation and feel free to unmute and respond as you would like to. And then if we have some pauses, I'll just make sure that everyone has a chance to speak before we move on to the next question. So question 2 is, from all of you here present, what might be the one message that you would like our audience, which is a mixed sort of group of different stakeholders, what is the one message that you would like to convey regarding an issue that should be addressed to promote healthy aging in the adult autistic community?
Do you want me to start? I can start. The one message I have for the other stakeholders here is really, we're not children. You can't take the experiences that a child might behave to what an adult is. Also, life is so much better when you get out of the school system. I'm sorry, the school system is traumatically difficult for our children. And so once they get out, give them a little time to decompress after that trauma. But we're not children. And even if you have, if you're a parent and you have a child who is on the spectrum, who is severely affected and is going to need 24/7 care, it might be easy to look at them as a child, but they're an adult and they have different adult things going on with their body and with everything else. So just please be respectful of that. Don't try to generalize what goes on in children to adult. And also just leaving that experience in that system of the education system is life-changing for us. So don't say this worked in education, so it's going to work here. It probably won't. And let us have the freedom and the joy of not being in that system anymore. I actually did quite well in that system, but it is traumatic. So.
I'd like to echo what Anne just said. It's true. It's like it's almost like it's a cookie cutter kind of. I don't know if that's the like imagine like we all have to be exactly the same, learn exactly the same things, and sometimes we have different skill levels, different interests, different passions, and we're all expected to do great in all the subjects that we take, and it can be really stressful, traumatic. It's like, I've been wondering if there needs to be a change in our education system, the way we, not everyone's going to be interested in, I love art, but, not everyone wants to be an artist. Not everyone wants to be a civil engineer or a CEO of a business. Not everyone wants to be an accountant. And sometimes it's like, some people are very good with numbers, and it's a good thing we have Excel spreadsheets and are able to like copy and paste stuff. But sometimes, it's like, I love history, for example, big fan of history, and I love art, visual arts and books, but not everyone's going to be interested in that. And, sometimes it's like, and I really think you should read whatever you want in school, there are some books I'm like, oh, this is a classic, you got to read it. But sometimes like, you know what, I want to read my Lord of the Rings or whatever, Game of Thrones, the Song of Ice and Fire, whatever it is, or Star Wars novel, that, just be able to do what you want to do when it comes to education, as long as it's, with the proper guidance. And I know that we have like IEPs, which is again, I'm bad with acronyms, but, JoAnne, IEP, Individualized Education Plan. Yeah, that, thanks, JoAnne. Yes. And then the other thing is, one of the things that I wrote down on my notes is, I also agree with Anne, don't infantilize us, because sometimes it's like we're treated like children. And just because I love Star Wars doesn't mean I'm, and I collect action figures doesn't, right now I'm at work, I'm being a professional, I'm dressed. If you see me on the street wearing my Star Wars t-shirt, don't assume I'm being a kid. I'm just, being a big fan. But in the work, I've learned to how to, okay, this is a workplace. Now I'm like in my dress clothes, I have to be in that role. When it comes to healthcare, really quick, one of the things that we're working on a lot of things here at the Mailman Center, but flexibility. I've heard from a lot of parents. For me, health, aging as an adult, insurance issues like, oh, I want to see this doctor? No, but my insurance will let me, whatever that is. But I haven't had that challenge of being able to get a doctor because of my autism. But I've seen parents who've had children, adults with autism, going from pediatric care into adult care. And here at the Mailman Center, we're working on how do we bridge that gap. We've got a clinic here that specializes, and we just opened it. It's less than a year old, and it's like we're trying to make it, so that, okay, this particular patient does not speak. They do not, they won't, not even with alternative assistive communication devices. So it's sometimes the parents who's advocating, and sometimes we need the medical expert to be flexible. And I'm thinking about a parent right now who sent us an email talking about the concerns that they had about like not getting the needs they want because we need to be a little more flexible. And I see that Karl has his hand up, wants to comment or ask a question.
Actually, I just wanted to make sure I went next because I have a few things to say, including related to what you just said. I mean, as far as I'm concerned in regard to getting older while on the spectrum, one aspect of getting older, especially as a senior citizen, is that you're going to require more and more services of various kinds. I mean, the most significant of these being health and medical services, but also if you get social services of any kind, or if you're if you get senior services of any kind, or if you're living in an assisted living facility, any of these situations, the people providing the services need to have some knowledge of autism and the autism spectrum and what kinds of challenges and deficits we have that are particular to the autism spectrum, as well as the kinds of needs that we have that, again, are particular to living on the autism spectrum, because we are anything but typical people. And this is throughout the entire lifespan, but as you get older, since these people are going to be providing services for us, they need to understand. And later on, I'm not going to talk about it right now. This is for one of the following questions. I want to address some issues that involve the healthcare system and navigating through it, which is a whole, as I said, is a whole issue unto itself. But in general, like for instance, in anybody providing senior services of any sort, there are pretty much typical, even stereotypical activities for senior citizens to be involved in. And if you have a person on the spectrum with unusual, specialized, and very different interests, those activities are not going to be helpful at all. Or even something as basic as, say, there's a reading library. It could very well be that for the autistic person, there may not be a single book in that library that they would be the least bit interested in reading. So, you need education of people who provide services to make sure that they understand the specific needs and challenges of their individuals on the spectrum that they are going to be helping. And if not everybody is capable of doing this, then it's necessary to make sure that the person assigned to be providing services or assistance to somebody on the spectrum is somebody who actually knows something about autism and can appreciate our particular and generally unusual needs. Okay, I guess that's it on that.
No, but thanks, Karl, because that's so true. It's like it is a challenge. Everything has to be like individual. For us, it's like very individual. One of the things is, I'm going to say something we know we repeat a lot in the autistic community. Once you've met a person on the autism spectrum, you've met one person on the autism spectrum, and it's like, which is why I always make it like I get the services I need as a person who's on the spectrum, but I also like to meet other people on the spectrum so I can learn from them. And then now it's like, wait a minute, there's this gap over here.
Elisheva has something to say.
Yeah, I do. As soon as I can figure out that unmute. So I want to pick up on the issues of education and think about it from a different perspective in aging, because I didn't come into my own in education. I mean, I have probably 4 degrees, maybe 5, and a lot of other education that didn't go anywhere except for that it made me in a lot of ways who I am, because I am one of those people who I pursue an interest until I've learned it. And then I pursue another interest until I've learned it. And so, I was called a perpetual student because I did a lot of education without getting any degrees. And I think that, and I am a special educator, but I started out, my first career was as a geologist. And then it went on, and special education actually came, I call it self-defense, because I was the mother of a son who really did not fit well into the school system. And it's as I've gotten older, I'm less concerned about what people think. As a female, you're often still concerned about what people think. So, I spent a lot of time masking myself. And I think that in being freed from that and realizing that, my everything that I have done, I took my son out of school. I educated him at home myself. And I think that's something to think about with kids, because what I've seen as an educator, as a teacher, and then, the work I do now, is that a lot of times the schools are not meant for them or us, if we want to think about it. They're just not built for us. They're teaching right now to the lowest third, but they're teaching, they also treat you. And I even got treated like this when I came out of the closet as an autist in my graduate school years, in a course on autism. I found that I got treated like my IQ had suddenly dropped like 50 points. Because you have autism. I think that there's a lot of people who don't speak, who are a lot smarter than you neurotypicals think we are. We see the world in a different way. And we have quite a lot of skills we could teach you. So that's what I want. I guess I want everybody to know. And this is the issue. You're not helping me. I hate it when people help me when I don't need help. But then they're often not there when I do need help. Everybody needs help sometimes. But take a look at what people are doing and refrain from fixing things for people all the time is what I would say. And remember, nothing about us without us. A lot of times, you're going to help us, and it becomes this big, I'm a hero because I'm helping these people. Well, no, if you're a teacher or whatever, you're a teacher. And it's your job to make yourself useless. It's your job to make the person, whatever grade you teach or however you teach, that when they get done with you, they don't need you anymore. And that's the reality of it.
I'd like to add a little something to that. I agree with everything you said, but really this is one of those things that cut both ways, because on the one hand, sometimes, people may not expect you to know or be able to do something when in fact you do so very well. But the problem that I've had throughout my life and is also goes through the entire life cycle up, including senior citizens, is that just because you have some unusual ability or some unusual talent or some unusual skill, that there's an automatic presumption that you're going to have absolutely no difficulty with much more basic things. And in fact, we often do. And the most challenging things for many people on the spectrum, regardless of how intelligent you're considered or how well you did academically or scholastically in school, is that we have difficulty with many of the most basic life skills, because the presumption is that you're able to learn, you should be able to pick these things up almost effortlessly, when in fact that can very often not be the case. I mean, and I have heard numerous stories that, from, especially at conferences, at workshops of, parents and people who work with kids on the spectrum, let's say, how is it that this kid who has this amazing talent or this encyclopedic knowledge of whatever their special interest happens to be, have so much difficulty with the most basic life skills and with the most basic social skills and things of that sort? And that, by the way, I've found does persist into adulthood and even into old age. And anybody who is working with us or dealing with us needs to be able to appreciate it. In fact, I'll try to briefly tell a favorite story of mine, which is a recent event. Is, as a technical person, I helped a friend out. He needed a new computer, so we went to a computer store, picked one out. I set it up for him, and the poor guy was practically freaking out because he has difficulty with this stuff. I got everything perfectly working, all within a couple of hours that I had to leave, and he was very happy. Okay, but rewind back about 12 hours. I'm at a clothing store, trying to purchase some new clothes, including I needed, a few new pairs of pants. And I'm looking at it, the different cuts and styles and everything. I had no idea what the hell was going on. And had it not been for a very helpful salesperson who actually pointed a few things out and led me to some that were better for older adults, I literally came frighteningly close to having a meltdown in the middle of JCPenney's. And this was just 12 hours prior to my doing something that is considered, many people consider to be quite difficult and is seen as requiring special ability or talent, and which I do have in this particular area. But at the same time, I can have a lot of difficulty with things that are considered much more basic, that nobody at my age or my level of education or my level of intelligence, whatever that means, should have and should have been able to do a long time ago.
Thank you, Karl. That's a great segue into our next question. But before we move on, JoAnne, do you want to add something about?
Just really quick. the education system is definitely not designed for autistic people. Mainstreaming them doesn't work. I was diagnosed as gifted at the age of 5, reading before I even hit junior kindergarten at the age of 3, but I did not complete high school. I'm 2 credits short. So it didn't work for me. And I got very good marks, but I definitely agree the education system is not designed for us. The one thing that I really wanted to say was, as we age, people with autism, our senses are definitely more intense than other people. We can self-diagnose basically, oh, I have a heart condition. How do you know? I can tell, I can feel it. Doctors need to listen to us when we say something's wrong, my ear's off, my balance is wrong, that's too bright. Oh, I'm losing vision over here. I can smell something, it's not good. Listen to us. We are the canary in the coal mine. We're telling you something that could be, cancer, but you guys won't be able to find it for 2 years, but we know it's there.
Thank you. And I think actually that's a perfect segue too, to think about the next question, which is what are the greatest unmet needs that you have found as you have aged?
I'll just keep going. The unmet needs as I have aged has been anxiety management. Going out in public, they say that they have, a couple of hours at the grocery store where they dim the lights and turn down the speakers. No, they don't. It doesn't work. I get terrified in a grocery store. I can go to a farmer's market, but I get terrified in the grocery store. They're too bright. They're too loud. You have to wear sunglasses and earplugs just to go get a loaf of bread. It's ridiculous. That's my biggest thing is anxiety management. I have no idea how to maintain that yet, but I'm working on it. I've got a new therapist that is trying to adjust meds for me so that I can focus and function.
Hi, this is Jairo here. What JoAnne said just resonates with me because, yeah, I mean, I do see the doctor who diagnosed me with autism gave me the proper dose, the proper prescription. Before I tell this story, just really quick flashback. I was misdiagnosed as bipolar, given the wrong medication. Then I had to go to my therapist said, no, you're not bipolar. You're getting a second opinion. Anyway, fast forwarding to more recently, yeah, lights kind of used to bother me and certain sounds and not anymore. I'm wondering if it's a medication that's helping, when you get the proper medication, because yeah, certain lights would, these white lights kind of like would annoy me at some point if they hum. That and I don't know, maybe was it something I don't know. It's just a sensory issue that I used to have and I don't have it anymore. So I guess I've changed in that way, which is good. But thanks for pointing that out, JoAnne, because yeah, that's something that is a big issue. That sometimes it's you get the right medication, you get the right resources, and things get better. But yeah. And flexibility, again, I have to use that term, flexibility in our education system and healthcare. Oh, and another challenge that we have is that I've seen in our population, employment, or if you want to start your own business, big barriers right there.
I have something to say about the healthcare system. I mean, this is a particular and specific issue that I managed to stumble upon because of my experiences, but nevertheless, I think it's important enough that it's worth my discussing. Basically, the healthcare system has become so complicated and Byzantine to navigate, and in particular, these healthcare provider networks. Because one aspect of aging is that, when you're younger, if you get sick or you have to go to the doctor, it's usually for a fairly routine, typical thing that, just about any doctor or medical practice or walk-in clinic or any place can treat. And that's certainly true of the typical population, and it's probably true of most of the autistic population as well. But when you get older, you have all sorts of unusual conditions and illnesses and whatever that develop that require very specialized medical attention. In other words, you need to get the right specialist. It's not just a matter of not only going to any old doctor, but for instance, at one point I had a sinus issue that required sinus surgery a few years ago. And what I needed was not any old ear, nose, and throat doctor, but I needed a surgeon who specialized in sinus surgery. And the only way I was able to get a referral to such was through my primary doctor, because the websites that they'll just give you ear, nose, and throat doctors and won't tell you that you need a very specialized surgeon who who's familiar with this particular procedure and has done it many times. So navigating through the system is, I'm what's known as a good systematizer, as are a number of autistics. If there's, a system to anything, I'm usually quite good at finding it. So navigating, through, different websites and such on the internet is something that I can do, or at least can learn to do with a small amount of practice. But in the case of health and insurance, I wasn't able to do it at all. And if it was this difficult for me, I could just imagine what it would be like, well, for anybody else, but especially for another autistic person who makes no rhyme or reason of this. So, I could see how this could really be a problem for a lot of older autistics.
Yeah, that's really important, Karl. And I saw you had put something in the chat. Do you want to talk a little more about your experience?
No, one thing I did this year is, and I have a group of middle-aged women friends who are autistic, and we sort of have given up all garbage. Does that make sense? We don't put up with it. We immediately walk in and say, I'm autistic. I expect to be treated this way. And so we've been doing this sort of as a trial, but I totally disassembled my entire medical support network earlier this year. And so in February, I just went and got all new doctors. I got younger doctors who had grown up with kids who might have had autism, who might have been classrooms. They were much better at listening to me. I actually I contacted the president's office of the head of our local hospital. And I said, I'm autistic. Who do you recommend that would be willing to deal with my needs? Also, because I live in a suburban area where I also made it very clear that, upon telling me this, I have no trouble telling other people. But if you can't recommend anyone, I'm also going to tell them, avoid your place. And because I went in with this very different attitude of doing that, I've had much better time now because they're not looking back at past experience. I sort of came in with a very powerful thing. We will see how long that lasts, but it's been very good. But the other women I know who are also doing this, we've been very, very self-advocating, but also very much like, if you're not going to satisfy my needs, we'll go somewhere else. And also being able to threaten the social network, the social websites and stuff, saying, we have no trouble, but we're also going to spread it. We're also going to tell other autistics, because there are a lot of us out there. We are no longer this very quiet thing. We can connect through the web, and that has been helpful. So I look at yes, you too also redid this spring. Sometimes you have to dismantle your old systems to get the system that actually build the system that fits your autistic brain. So,
Elisheva, do you want to talk about what you think are the greatest unmet needs as you've aged?
Yes, I do. I think that we need to remember that pediatric autism is about 20 years. And so we need a lot more research on adults at every phase, and particularly women. I was at a one-day autism conference last fall in Phoenix. And when I kept asking about women, about aging adults, where there was a doctor there, talking about different issues of physical and emotional with autism, what I got was, well, we really don't know. We really don't know. We really don't know. So I think that there is a really good area of research there for people who do medical research to enter, and that is thinking about the differences with the sort of intersectionalities with women with autism, with aging adults with autism, and I would also say that I would like to see good medical care unbiased by politics. There is a definite politics right now, and who's in charge with our medical care. And, we may have different needs, but everybody does. And so it needs to be unbiased by, let's stop having government people. They have their job to do, but let's stop having them manage our medical system, because it just leads to endless bureaucracy and problems, as I think several have said before, because I have such difficulty when I can't cut through the crap, frankly, and find who I need to talk to about something. Okay, so those are my suggestions.
Thank you. Anne, I see your hand is raised. Go ahead.
Yeah, I just want to reiterate things too in recommendation. We really do not understand how the heart works in autistics, and it is sort of scary. We don't even realize that it affects children. So any research regarding how our hearts work I would greatly appreciate.
Thank you. So looking at the time, we have about 15 minutes left. And as we had sort of discussed over email, I don't think we're going to make it through all of our questions. So the next question we'll switch over to, and we also had a question from the audience that I'm going to try to weave in, if you can think about in your responses. But the next question is, do you have concerns about aging? If so, what are they? And then if you think it's relevant, some of you have already talked about this, but can you consider how your own identities and intersectionality of gender, race, ethnicity, et cetera, may have played a role in some of those concerns for yourself? And maybe I'll ask Elisheva, do you want to start us off on this, if that's okay?
Unmute again. Okay, so my biggest concern with aging is the concern about the brain differences, that there's a stereotype out there that our brains shrink, and all brains do shrink as we age, not just people on the spectrum, but that we have more shrinking, more problems with loss of functional, gray matter. And, but there's a lot of generalizations about that. And I think this is why, in some ways, that medical people treat, older people as if we are, we don't know anything, that we can't do anything. But I do have concerns about that. Are we more prone to, getting Alzheimer's? Are we more prone to certain things, or are we not? So I'd like to see a look at those brain differences, because that concerns me. And also, my other concern as I age is going to be what happens. It's very difficult for me to speak for myself sometimes. I need a good situation like this one, where there is sharing and yet somebody's moderating. And I'm just wondering, what happens when I can no longer speak for myself? Because women, again, very often they might be dehydrated and they're taken to the hospital. Oh, she has, she has Alzheimer's or she has some kind of dementia, when really it's just dehydration. And I've seen that happen to people. And so all of a sudden you're on this train that you can't get off of. So those are some of my biggest concerns with aging.
I'd actually like to briefly add to that, because as a matter of fact, something Elisheva said a bit earlier about how, as an older female, you often don't get taken seriously. As a matter of fact, I know somebody, who is also an older female and a good friend, who tells me exactly the same thing. And it occurred to me because of a comment that I made earlier, that my experience wasn't so bad, that I'm simply seen as an older eccentric. But I get the distinct impression that with males, this, sort of thing that we're talking about may happen, but it's not as serious a problem. In other words, if you're unusual or peculiar and you're male, you're seen as eccentric, whereas if you're female, you're more likely to be regarded as crazy. And, this is a tragic situation. And, the impression that I get is that this affects everybody, but in particular, as autistics, this will be an even more significant issue. That's all I wanted to say about that.
I just wanted to add, to what Karl was saying just now. I wrote it in my notes because it's like an idea that just got into my head. It's like, many inequities in our healthcare system and in other areas, many inequities and injustices are due to assumptions and biases that are made. And so then that can create a lot of tension and makes things even harder for all of us. So, yeah. I just wanted to add that, just mention it, throw that in there, right there. And just really quick, I'm really happy to be here. It was a great panel.
If I can build on what he just said, one thing I would like researchers to do is start looking at how we interact with systems from a social justice lens, and especially look at are we getting equitable care or equitable treated equitably? Do we have access? And a lot of times we don't even have access because of communication issues, because of different executive function issues. Are we able to participate? And a lot of this goes back to communication. And finally, are our rights being respected? And to me, as I get older, that all has to do with autonomy. The more autonomous I have, the more I can deal with my sensory issues and things like that. As part of my last statement, I'm going to also say, yes, I'm having some different issues with aging, but I also am the most optimistic I've ever been. And partly that is because I do work with a lot of younger self-advocates, and they're very respectful and very nice. And I also find it very uplifting that they look at the entire spectrum and they self-advocate not only for themselves, they often self-advocate for some people who have very severe needs and can't necessarily advocate for themselves. And because of that group, I'm actually at a very optimistic point right now, because it's just, I'm just feeling better about it than I have in a long time. So while it's tough, and yes, it's hard, and if people keep inventing these complex systems like healthcare and things like that, it's going to be worse. But I'm also I'm feeling optimistic about it. So I'll just leave on that note. So thank you.
JoAnne, do you have anything that you wanted to add for this question?
Yeah, for me, the aging, I do have some concerns about getting older. I am approaching 50, but I've noticed a reduction in my vision, which is normal. But for me, it also causes a little bit of a sense of panic in that I'm so used to seeing and hearing and smelling absolutely everything around me. As things start to go away, does that mean that my brain's going to go too? I have very serious concerns about Alzheimer's and memory loss and aphasia and those kinds of things. Because, like I said, I lose track of what I'm trying, like what word I actually want to use a lot of the times, which wasn't a thing before, but now it is as I get older. And I'm hoping that it's not, like an early onset kind of thing, but hey, you don't know, right? So I have been asking my care providers about things like that as well.
Okay, thanks for that. So we have about 7 minutes. So we are going to try to squeeze one last question in. Sorry, Jairo, did you want to add to that?
Hi, yeah, thanks, Vanessa. Just really quick, here at the Mailman Center, we're doing I'm very fortunate to be part of a team that with great medical students who are addressing like health inequities. We've created, for example, a clinic, which is the progression across transition in healthcare clinic path. We call it PATH. And there's we also have like a MAP program, which is, again, a lot of acronyms. That's a medical student. Sahana Shankar has designed it, and it's like where we teach. It's called medicine as a profession, where we actually talk about disability to first year and second year medical students. So that way, train them now when they're young and not later regarding disability and autism. And also, we're trying to design like a training for healthcare providers with Dr. Ashley Falcon. I did a leadership program with her, and we came up with what we call DASH, which is the Disability Awareness and Sensitivity in Healthcare, which is like an online interactive learning, watching videos for healthcare providers. So we're addressing this issue here at the Mailman Center, but it's really good to see that a lot of things are getting better, but we can do a lot more. And so I just wanted to throw that out there. I want to mention, shout out to my team at Mailman Center for making me part of the team. Like, again, nothing about us without us. They include me, and then I'm like, oh my gosh, this is very interesting. I'm learning a lot more, and I'm more conscious and aware of the inequities that are out there. So I just wanted to mention that really quick before we,
Yeah, no, that's wonderful. I appreciate that. And, I think actually maybe it's a really powerful note to end on, I think, if that's okay. And I'll just say, I wanted to kind of wrap up really quickly and try to highlight some of the themes that we're hearing across these items. Karl, go ahead.
I have one comment that I'd like to make. This pertain to what would have been the last question, namely,
Sure.
Looking back with hindsight, what resources or understanding do you wish you had to support you as you aged? Well, for that, I just have a general comment, which is one of my favorite themes, namely the value of early intervention, that the more you address autistic issues at an early age, the less of a problem they're going to be as you get older. For instance, anybody who has any kind of difficulty or deficit with social functioning is going to need some kind of social skills, remedial training, or remedial education or whatever. Same thing with daily living skills. And this may be true beyond the autism community, but certainly for the entire autism community. And again, to emphasize, it doesn't matter if you're a twice exceptional student or what your IQ or other standardized test scores you got, or what, how smart anybody or everybody thinks you are. If you have difficulty with these areas, they need to be addressed, because otherwise they could cause serious problems for you later on down the line. In particular, one thing that I've noticed in regard to employment, and this is over 20 years of being involved with the autism community and meeting numerous people in support groups and workshops, conferences, and whatever, is I've known a lot of people who have lost jobs, and yet I have yet to meet one single person in the autism community who's lost a job because of incompetence, not knowing what they were doing, malfeasance, trying to cheat or steal their employer, or absenteeism or chronic lateness, or any of the usual reasons people get fired. It's always invariably some interpersonal issue, some social issue in regards to getting along with coworkers, some issue in workplace politics, which can be lethal for autistics, and never once for any of the usual reasons. So what this tells us is that these skills are very important. Same with daily living skills. You need them to be able to live independently. And if you can't live independently, you're going to be a drain on the system. If you aren't able to get a job because of the kinds of issues I was talking about, again, you're going to be a drain on society. Whereas if these issues are addressed early enough, then an autistic person who otherwise would have needed a lot of services and assistance and things that cost taxpayer dollars, instead can be a contributing member of society and a taxpayer, and also have a good quality of life. So anyway, that's my standard spiel about this issue.
Thanks, Karl. I think we're just about out of time, and I'll just highlight what a nice job everyone has done really bringing forth issues, I think particularly about development and change, the importance of opportunities to continue to learn across the lifespan, the change needed to many systems, both early and later in life, and the importance of finding environments and people that really understand the things that you want them to understand and can provide the kinds of supports that you're feeling like you needed. So thank you so much for all of your powerful stories. And I'm going to turn it back over to Arun.